My name's Kate Hopwood. I'm the named midwife for safeguarding at Somerset NHS Foundation Trust. So what I'm going to do today is just give you a whistle-stop tour, as we all are, I think, of maternity services in Somerset, what that looks like, and in general, and also from a safeguarding children perspective. So, some of you, or most of you, probably are aware that within Somerset we have two main sites. In April this year, we officially merged Somerset NHS Foundation Trust and Yeovil District Hospital NHS Foundation Trust merged to form one Somerset-wide foundation trust. So we have two main sites in Somerset, Musgrove Park Hospital and Yeovil District Hospital. So I'm not going to read out all the stats because for two reasons. One, you can see them on the screen, and also you're going to be sent the slides afterwards. But Musgrove is the larger site, approximately 3,000 births per year, and Yeovil, slightly smaller, 1,300 births per year. And within each hospital, they're slightly different across both hospitals, but there are services including obviously our inpatient maternity wards and community services. We also have a dedicated home birth team and a number of different community teams depending on the location that our patients live and which doctor surgeries they're registered with. So that's just a general overview of our maternity service. What we have specifically in terms of families with more complex needs and vulnerabilities is a specialist midwifery team. So they are made up of complex care midwives. It's known as the WREN team, WREN. We cannot, unfortunately, we can't take the credit for coming up with this because we scrupulously pinched it from another trust, but WREN stands for Women Requiring Extra Nurturing, and that is essentially the core function of that team. Our aim, if I bring that up on the screen, as you can see, is to remove the barriers that mean that women receive lower equity of care due to their social situation and vulnerabilities. So our aim is so that all women who are pregnant receive the same safe care, have access to the same services as the rest of the county. And so a huge amount of work goes into looking after the ladies who have the most significant vulnerabilities to ensure that they have safe outcomes and safe and healthy babies. So specifically what the WREN team do is caseload the most vulnerable of our patients. So some of the examples of that would be victims of domestic abuse. We provide caseloading to pregnant women who have had older children removed from their care, substance users. So that really the vulnerabilities which are going to mean that they are not able to access the same level of care, and we try to build those bridges between the patient and the services that are provided in the wider maternity service. So our team, as well as providing clinical care to those vulnerable patients, we also provide support and advice to the rest of the maternity service. So that is for community midwives and also for the inpatient wards. So we have a duty midwife, a duty WREN midwife every day during the week who speaks to all the wards across both hospitals, supports with any ongoing concerns that there might be about a patient on the ward, supports the ward with ladies who are waiting to go to court for decisions in terms of their baby and kind of forward planning, even down to supporting somebody with speaking to a patient about domestic abuse. So they do a lot of ad hoc kind of acute work as well as that long-term relationship building work with the patients that they're looking after. So this team has grown over the last 4 or 5 years, and we're extremely proud of what the care that we provide and the effect and impact that we have in a positive way on families that come underneath our service. So in terms of how midwifery fits into the rest of multi-agency working, I think even though a pregnancy is only 9 months long, and probably compared to lots of other agencies working with a family, we have a relatively short period of time to effect change and to support multi-agency working. But what we can do, there are quite a lot of things that we can do. So one of the most important things that we know is information sharing. And this starts at the very, very start of pregnancy. So all of our bookings, all the information that we receive from a patient when we book them at the start of the pregnancy is shared with the GP and health visitor. And that's standard for all women who book for maternity services in Somerset. So information sharing, as we all know, is absolutely essential in terms of safeguarding children, making sure that all professionals and agencies that are involved with the family are aware of information that we hold, and also making sure that we are aware of information that they hold. We know that during pregnancy, parents are much more open to change. They're much more likely to make changes in their social circumstances, in their personal lives, in order to act protectively towards their unborn baby. And so one of the things that we do in midwifery is make sure that where we can, we identify those risk factors as early as possible, and signpost where needed, or provide that support ourselves. So those early risk assessments, really, really important. In terms of engagement with services, there's lots and lots of services that we signpost to, drug and alcohol service, domestic abuse services, baby basics, as well as liaising with the universal services that everybody is entitled to. We more so in Ren team, I would say, than in the wider maternity service, but definitely in Ren team, we are very committed to using the SSCP pre-birth workbook. You can look at the workbook on the SSCP website, and as well as Children's Social Care and the Family Intervention Service using that workbook, we also, along with Public Health, work with families, complete different sections. So we're very committed to completing that with a family throughout the pregnancy, so that they have some of that education and some of that that work in terms of thinking about the impact of the arrival of their baby before their baby arrives. And again, that early help multi-agency planning. So we are involved in team around the family processes, and as well as the higher level safeguarding processes where children's social care are involved. So we very much form an integral part of that multi-agency team working around a family. Yeah, delivering patient support. Making every contact count, so important, isn't it? And we again make sure that we're providing that education at every single appointment, whether that's in the unit if somebody is going in for a kind of acute episode of care, but also those regular appointments where we see women throughout their pregnancy. More widely, our responsibilities as midwives is to promote the health of the mother and unborn/new baby. So again, it's that public health promotion, smoking cessation, healthy eating. We do a lot of work around healthy parent and child attachments. We're very, very lucky to work closely with the perinatal mental health team. And where we do have concerns around parents bonding with their unborn baby, we can refer to perinatal mental health team and do joint work with them around birth planning from a mental health perspective, information sharing, and again, those early and ongoing risk assessments. So one of the largest piece of work and the big focus that has been a core part of our development recently is around fathers and partners and other household extended family, other household members, and the identification of risks and protective factors that those people provide to an unborn baby. So again, making sure that we're not just thinking about mother, we're thinking much more widely, and we're working closely with public health, nursing and GPs to do this effectively. Making sure that the voice of the unborn is heard. I think it's very easy to think that during pregnancy the baby hasn't arrived and therefore it's not here yet, it's not impacted by various risk factors, but it very much is. So we make sure that whenever we are contributing to assessments, reports, all of those referrals that we do, that we're focusing on the impact of the unborn and what life is like for that unborn and what it will be like when they're born. And as all of us, we follow and contribute to the South West Child Protection Procedures. But on the end there, we've just popped some the links to some of the things that I've mentioned in the PowerPoint. There's a contact email on there for Ren team. If you do want to get in touch with our team for any reason, then please do feel free to email us, and also some links to the workbook and the pre-birth planning toolkit as well. Thank you very much.